The developed world and the industrialized world just doesn't seem to get it. It really doesn't. It talks, the rhetoric is fine, it's all about sharing, it's all about fairness, but in reality, when push comes to shove and these products are available, they are hoarded in countries and they're not shared. We are seeing, for example, dexamethasone and IL-6 inhibitors which modify the immune response being used. Dexamethasone is used widely, but IL-6 inhibitors are expensive. They provide an additional benefit, but there are, again, no more than with the vaccines. There are a very small number of producers, and most of those doses have been sold to the wealthy countries. And we're struggling to access doses of IL-6 inhibitors. I believe, Maria, and that's another inequity. Okay, it's not as glaring and it's not as obvious and it's not as public as the vaccine one, but once again we repeat the same inequities. It doesn't matter at the large scale or at the small scale.
But this is not just unfair, it's not just immoral, it's prolonging the pandemic, and it is resulting in people dying. And I think we need to be blunt. I think we need to be very clear that this is prolonging the pandemic. We have tools, we have enough vaccine around the world. If we had used the vaccine doses that were available differently, we would be in a very different situation right now globally. But it's the same thing with PPE. It's the same thing with the therapeutics.